You've built a successful life, but now what? Welcome to the Gen X Collective podcast. We're for men who are navigating midlife with purpose, health, wealth, family, work, and the mark you've made on the world. We're talking about the stuff that really matters with experts who have solutions, advice, and a sense of humor. And now, here's our host, Laurent Truc.
Hey everyone, and welcome back to the Gen X Collective podcast, the show where we dig into the real stuff that matters as we navigate the second half of life. Today, we're talking about something that often gets overlooked until there's a problem: oral health. Joining me today is Dr. Vinay Bhide, a top periodontist and educator who works out of several practices in the GTA. Vinay's been on the front lines of oral health for decades, and he's here to help us understand why our gums and teeth might be telling us a whole lot more than we think. So whether you floss daily or you haven't seen a dentist in a few years, this one is definitely worth listening to. Vinay, welcome to the podcast.
Laurent, thank you so much for having me. It's an honor to be on this podcast.
Awesome. Well, looking forward to getting a lot of wisdom out of you. Let's start from the top. You built a really impressive career as a periodontist. Could you give us a little bit of background, how you got started, why this track in your life, and how it's going?
Absolutely. So I think like most people, if you ask them about how they ended up in a certain career, it was never their first choice, right? And, growing up, I had my sights set on being an accountant because I'm good at math, I'm a numbers guy, I like statistics, all that stuff. And my parents were fully on board with that. My mom's a psychiatrist, my dad's an engineer. And both of them said to me, don't go into medicine because days are not good ahead. My dad said, don't be an engineer because you'll work way harder than you get paid. So, just focus on your education, do something that makes you happy. So for the longest time, I wanted to be an accountant. And then I realized that in accounting with computers getting into the mix, I thought, do I want to be in a career where maybe it's going to be more computer heavy and maybe not as much face-to-face with clients. Now, I am wrong because my accountant's a great guy and he's very good with the personal interaction. That being said, I always had this interest in the healthcare field. And my real kind of exposure to dentistry came through my orthodontic appointments. Like most kids have braces when they're 10 or 12 years old. And I loved my orthodontist. I thought, hey, you know what? This seems like a really good career. This guy comes in, says hello, hi, checks my teeth, the hygienist doing all the work. And he's able to see multiple people at the same time, and everybody loves their orthodontist. So I thought, okay, dentistry would be a pretty good career. So I applied out of my fourth year in university. I was studying at McMaster for my undergraduate, got into dentistry somehow. And as I got into dentistry, I thought to myself, wait a minute, I find the field of periodontics a little bit more interesting than orthodontics. So I started doing summer research with a clinician researcher at the Faculty of Dentistry, University of Toronto, who really turned me on to all that periodontics has to offer, both as a clinical specialty and also its broader role in systemic health. And, one thing led to another. I put my full sights on becoming a periodontist, and then went back after dental school to study periodontics at University of Toronto up in 2005. And here I am, almost 20 years later. Love what I do. I'm in private practice about 4 days a week. I also combine my private practice with teaching at the university as well, both at the undergraduate, graduate levels, lecturing, clinical teaching. And over the last number of years, I've gotten more involved in the continuing education side of things, where I'm traveling frequently, giving lectures at different places all across North America. And it's been very rewarding, and it's nice to have the opportunity to talk about.
Very cool. Very cool. Just so everybody knows, like when we say periodontist, what exactly is the range of services versus a general dentist or specialty?
Great question. And I love that you asked me that, because anytime I tell people I'm a periodontist, they'd say, oh, that's like an orthodontist, right? And I'm like, no, it's actually a periodontist. An orthodontist is totally different. So periodontics is a field of dentistry. It is a specialty of dentistry that deals with the foundation or the infrastructure around tooth or teeth, namely the ligament that holds the tooth and attaches it to the bone the bone that houses the tooth, and then the gums that drape over that bone. So really, in analogous terms, I'm the foundation guy. Like if I use a contractor analogy, I'm the foundation guy. In lay terms, I'm a gum doc, right? I treat gum diseases to help people save their teeth. But when people are missing teeth, I'm also helping them replace them with dental implants.
Got it.
And other services that are key to my operations are things like gum grafting. We all get long in the tooth, especially in our cohort, Laurent, where we're now in our late 40s and early 50s and beyond. That saying, getting long in the tooth, is referring to gum recession. And I can fix that. I can make our gums younger. I can't make us any younger. And then there's the whole side of the periodontal disease, systemic disease interaction, which I know we'll be talking about at some point as well.
I had no idea long in the tooth came from that. That's awesome. So when does somebody go, I mean, you mentioned a little bit of when people go see a periodontist. What is the process, at least here in Canada? Like, does somebody seek you out when they have an issue, or does it always go through your dentist first?
So the vast majority of my patients come from referrals from the patient's general dentist. So, every 3 months, 4 months, or 6 months, as we're going to our dental offices for cleanings, checkups, maybe getting the odd cavity filled, they should be assessing the status of your gums, namely inflammation and whether there's gum disease or not. And if there is gum disease that they feel they can't manage in their practice, then typically you'll get referred to see me. Being referred to me is not necessarily, the thing that you want, okay? But at least if you're referred to me, I can help you. Now, it's not always disease that I'm treating. So some people have gum disease, they get referred to me. Other people may have recession that is causing them sensitivity or an aesthetic concern, and they want that fixed. And other people may be missing teeth and looking to get function back, aesthetics back. I can help them with dental implants. And so I work in cooperation and collaboration with the referring dentist to optimize the care for the patients that are sent to me. That being said, I do have patients that are also self-referred. Unlike medicine, anyone can seek my services out. If they see me on social media, if they see me online, they can self-refer. As long as I know that they have like a dental home, a general dental office that I can communicate with, that's perfectly fine.
Got it. Okay. So let's talk specifically Gen X kind of age group, 40s and 50s. Why should, especially men, why should we pay close attention to our oral health?
So first thing I'm going to say, Laurent, is that oral health and systemic health go hand in hand. The mouth is a gateway to the rest of the body. A lot of times there are conditions that we have systemically that may be undiagnosed because there's no symptoms associated with some of these conditions. Like you don't know sitting there that you might have high cholesterol. You don't know sitting there that you might have Crohn's disease. You don't know sitting there that you might have high blood pressure or diabetes. And sometimes when we're in the course of looking at the patient's mouth, inside their mouth, looking at their gums, we may be tipped off to certain things that you might want to get that checked out because looks to me that maybe you have maybe some underlying condition. Get a blood test, something as simple as that. Okay.
Interesting. Specifically
Gen X, our age group, what happens as we get older? We put on a little bit of weight, right? Maybe our blood pressure increases a bit. Our blood sugar levels start getting a bit high. Okay. Cognitively, sometimes we don't feel like we're all there, right? Maybe not at this age, but maybe later on.
We're getting there.
Yeah. Oral health and periodontal health have been shown to be associated with all these conditions, namely metabolic syndrome, obesity, hypertension, cardiovascular disease, diabetes, respiratory ailments. There's even some research suggesting that there could be some relationship with cognitive function as well. Now, I want to make it clear, this is not a causative relationship. Okay? So I'm not going to be fear-mongering and say, if you don't floss, you're going to have a heart attack, or if you don't floss, you're going to get Alzheimer's or dementia. It's not that way.
Okay.
But the research is showing that these groups of diseases seem to be associated with each other. Okay. Now, for diabetes in particular, there's actually a very well-established two-way relationship between diabetes and periodontal disease, in that poor control of your diabetic status can manifest in severe inflammation of the gums and lead to bone loss around your teeth. Conversely, if someone has diabetes already or is controlling or having troubles controlling their blood sugar, having gum disease makes it that much harder. Okay. So that particular diabetes and perio relationship is very, very strong. But all this stuff with cardiovascular disease, it's an association. right? So the general theme here is oral health and total health go hand in hand. Try and optimize both, right? Because controlling one will help you control the other to some degree.
Got it. And for you, is it that clear? Somebody opens up their mouth, you see something in the gums, and you can generally associate that they probably, if they have unhealthy gums, can you associate it directly with it's probably heart disease or it's potentially Alzheimer's, or like how
no,
do you...
So that I can't tell from looking at someone's mouth whether they have hypertension or Alzheimer's, whatever. I may be able to tell if they have something like Crohn's disease or even like leukemia, lymphoma, or even diabetes, and that would tip me off to say, just get your blood tested. That being said, if someone comes in and they're, let's say, rather obese or have high blood pressure already, this is one of the things that I spend time educating them on and saying, hey, listen, treating your gum disease isn't going to make you lose 10 pounds. Okay. Yeah. But treating your gum disease will actually be better for your overall health for a myriad of reasons.
Does it go the other way around? So if you don't focus on gum disease very specifically, will that cause something else directly?
How do you mean? Like if you don't focus, like if
gum disease gets out of control, I mean, obviously there's, I guess, teeth loss and stuff like that, but can it actually affect internal organs and other parts of the body?
Directly not. I mean, there have been incidences in the literature of someone having a dental abscess that then travels all the way to their brain and they die, right? They get like encephalopathy and stuff like that. But that's very rare. Like if people say that's fear mongering, but it can happen, right? There's always a chance that something like that can happen. But there's no direct, like it's not like you can die because of gum disease. Gum disease, unfortunately, is not associated with many signs or symptoms. And when you start noticing the signs and symptoms, it's oftentimes too late, right? You're going to lose that tooth or there's nothing you can do. So the key is to catch it at your general dental office while it's still treatable. It's never curable, but it's treatable. We don't want to let it progress. Because once you have it for life, but we can control it. Much like a lot of these other inflammatory conditions like arthritis or even metabolic syndrome is thought to be more now of an inflammatory origin. And what is periodontitis? It is chronic inflammatory disease, right? And that's why it shares a very similar pathway of destruction, if you will, to some of these other systemic conditions.
And how does it present itself? So, I mean, dentists obviously know how to see it, but can you as an individual see it? Is it bleeding when you're flossing or the change in the color of your gums? Like how does gum disease really show itself?
So the biggest tip off is, I would say, inflamed gums and inflamed gums that bleed. So one of the chief complaints that I get often when I see a patient for the first time is like, hey, how's it going? Are you in pain or discomfort? No, but my gums bleed every time I brush. Like every time I rinse and spit, I see blood. So that's a tip off right there. The second thing is if you've noticed that, maybe teeth have gotten a little bit mobile or teeth have shifted, sometimes people start getting gaps between teeth. And this is all a tip off that there could be some underlying destructive process going on.
Can gum disease get better from just flossing, or is there a regimen that needs to take place and medication and things like that?
Right. So the treatment of gum disease has a continuum of therapies. So like most chronic inflammatory conditions, we like to start conservatively and work our way up, if we have to things that are less and less conservative, perhaps even more aggressive. So flossing alone, for some people, just implementing good oral hygiene, like daily brushing, daily flossing, could halt the progression of gum disease, but they would have to be in a very early stage to do that. Okay. The vast majority of patients I see are in that sort of moderate to severe category where no amount of flossing is going to actually correct anything. That's not to say don't floss, like you still got to floss, but now they're going to need some specialist intervention. So the best place to start really is getting a deep cleaning. A lot of us go to our dentist every 3 months, 4 months, 6 months, what have you, and they buzz around the whole mouth and keep things clean. You feel nice and minty fresh afterwards. And that's doing is keeping things maybe at a certain level. Okay. But to really get to the heart of the problem, you have to go a little bit deeper. And that's not just metaphorically, but physically. Okay. So when we measure, what we're looking at is we're taking this probe. It literally looks like a little ruler, and we're sticking it between the tooth and the gums at various points and taking measurements of what's called a pocket. Okay. So we naturally have a pocket that's maybe 1 to 3 millimeters. But when we see pockets that are 4 millimeters, 5 millimeters or greater with bleeding on probing, that typically is indicative of gum disease. Okay. Bacteria, okay, your mouth, my mouth, we have hundreds of bacterial species that live in our mouth. It's really a testament to our immune system that we're not getting infections all the time, because the immune system is like the surveillance camera that you have that's kind of keeping things under control, like the warning system. Bacteria love areas that are dark, moist, free of oxygen, because that's the best breeding ground for them. So if you're not cleaning or flossing properly, the bacteria get down there in sufficient numbers, they multiply. Then your immune system starts taking notice and saying, holy smokes, there's someone here that shouldn't be here. And the alarm bells start going off. Okay. And the analogy that I use with my patients is that, imagine that you have an ant on your floor. Okay. And you want to kill that ant. There's different ways that you can kill that ant, right? Like you can gently take a tissue and pull it and release it to the outside. You can take a tissue, crush it, flush it down the toilet. You could take a bowling ball and drop it on the ground, okay, and kill that ant. So yes, the bowling ball will kill the ant, but what else is it going to do? It's going to kill a little bit of the flooring too, right? And so what happens with the immune system is that when it initially starts fighting off these bacteria, it just sort of in a bit of a panic mode, and it starts firing cannonballs at flies. That's basically what's happening. And so there's, as much as there is the killing of the bacteria, there's also killing of the support around the tooth, which leads to inflammation. And the inflammation, if left uncontrolled, is what leads to destruction of the ligament, that shock absorber that holds your tooth to your bone. That ligament gets destroyed, and then the bone follows. And ultimately what happens, you lose more in your bone, teeth start becoming a little bit more mobile. And if it's left unchecked, the ultimate endpoint is tooth loss. Okay?
Wow.
So all this to say that, like in medicine, if you go to your doctor with knee pain, they're not going to say to you, hey, Laurent, man, let's sign you up for a knee replacement surgery tomorrow, right? They're going to do everything they can to actually improve your quality of life non-surgically and hope that they don't have to do surgery. Surgery is going to be the last resort. So just like with arthritis, for example, with gum disease, what's the number one thing we want to do? We want to try and remove the bacteria from underneath the gums and create a more favorable environment for the gums. The way to do that is a deep cleaning. How do we do a deep cleaning? By getting the patient in, breaking their mouth up into quadrants or halves, giving them freezing so they don't feel pain, so the hygienist can get down and deep and mechanically remove the bacteria from underneath their gum line. And sometimes even that is just enough to get some resolution of the inflammation of the gum disease. And then we can keep the patient on maintenance every 3 months or every 4 months. There are certain situations where the gum disease is advanced to the point where now, after some rounds of deep cleaning, we have to now do surgery, right? And surgery involves opening up the gums, cleaning things out, in some cases trying to regenerate the bone that's been lost as a result of the gum disease process. So, there's a continuum from non-surgical all the way to surgical, right? And that's all to try and save the teeth in comfort and in function, okay? Otherwise, we have to call it a day and say, hey, listen, there's nothing that I can do is going to make this tooth stable again, or healthy again. We have to cut our losses and take the tooth out and look towards implants or dentures or bridges or what have you.
Got it. And this deep cleaning that you're talking about, that's your specialty, or does a dentist still do that? Because I have to admit, I get my cleaning all the time, but I never had a deep clean, never had my mouth frozen for a cleaning.
Well, that's because you probably don't have gum disease. So, give yourself a pat on the back. Well, any dental office is capable of doing a deep clean, right? The dentist can put local anesthetic in, the hygienist can do the cleaning. Hygienists are trained mostly all the same. That being said, in a periodontal office, all we're doing all day long with these patients is seeing the most severe disease. So, my hygienists are dealing with this patient population day in, day out. So, perhaps they're not better than other hygienists, but they have more experience treating advanced gum disease compared to maybe the general dental office where, they're kind of turning things a little bit quicker, a little bit faster.
Got it. Pivoting just a little bit, is stress a big factor on mouth and gum health?
Stress is actually a very important factor because what happens with stress is that stress actually dampens your immunity. and your immune response. That's why, when you're stressed, you're more susceptible to colds and just general feeling of unwellness. And there have been actually numerous studies in my field that have shown a connection, association between stress and periodontal disease. Because again, with periodontal disease, you need two things. You need bacteria, but you also need your immune system's ability to respond to that bacteria. So there's the bacterial challenge on one side and the host response on the other side. It's like a bit of a seesaw.
Yeah.
So some people have really, really clean mouths, right? They have the same bacteria that you and I have, but yet they have severely destructive gum disease, even if they have amazing oral hygiene. And why is that? Is because there's something in their host response that is leading to that destruction. It's a variant of periodontal disease that is a little bit more aggressive and has maybe more genetic factors or some deficiency with the white blood cells and all that. Okay, so the immune system plays a big role in our ability to control gum disease. So with stress and a high level of stress, due to whatever reason, whether it's financial, whether it's personal, can lead to this decreased immune response. And what happens then is that the bacteria, when the cat's away, the mice come out to play kind of thing.
Sure.
That's what happens.
Got it. What about things like sleep apnea and snoring? Does that have any sort of relationship?
So maybe not so much to gum disease, but in general for our overall health, it can. In fact, some studies have shown that patients with mild sleep apnea, which is associated with hypertension, right? Patients that have sleep apnea typically tend to have elevated blood pressure just because the way that they're not sleeping properly. Even a mild snoring appliance or a mild oral appliance for treating sleep, or not mild, but an appliance for treating mild sleep apnea can actually positively impact the patient's blood pressure.
Okay.
But periodontal disease-wise, directly, I'm not aware of that connection per se.
Got it. Okay. So back to kind of Gen X's. So as we get older, do you recommend changing routines? Like what worked, brushing your teeth and flossing when you were 16 and 25? Is that still the same routine, or should we be adding elements to what we do?
Still the same. I mean, the basic is brushing twice a day and flossing at least once a day. And, hey, listen, I'm guilty too of not maybe flossing every single day, but you didn't hear that. But yeah, once a day of flossing, once a day of brushing, because again, I think if people understood what they're doing when they're brushing and they're flossing, and they can visualize what's going on, they'll tend to do it more. What we're actually doing is we're disrupting the plaque or the biofilm that forms around teeth every time we eat. This plaque or it's not just plaque, it's a biofilm because it's a living community of nutrients and bacteria that form around our teeth naturally. And so disrupting this biofilm is really the key to preventing it from getting underneath the gum line and progressing into more advanced gum disease. So just by flossing and brushing, we're removing plaque, we're removing biofilm. So doing it once in the morning, once at night before you go to bed, trying to floss once a day, morning or night, doesn't matter, is going to be beneficial whether you're 20 or whether you're 75.
Got it. I read something the other day that mouthwash actually was not a good thing because it's killing some of your natural biome within your mouth. What are your thoughts on mouthwash? Is that a myth?
Mouthwashes are great, but now we're moving to the mouthwashes that contain essential oils. The Listerines and all these other mouthwashes that we used to use back in the day had alcohol. And that's why anytime you rinse with them, they'd have this severe burn on your cheek. And yes, alcohol will dry out your tissues. Maybe it'll kill some of the bad bacteria. Maybe it'll kill some of the good bacteria. But I think it's more just for comfort. And essential oils are also having properties. They may not kill the bacteria, but they may stop the bacteria dead in their tracks. So a daily mouthwash, I'm not necessarily endorsing product per se, but like a Listerine Zero or Colgate Total mouth rinse would be a good thing to use.
Got it. Okay. So I know you're on the cutting edge of all this stuff. You're constantly going to courses and you're teaching. If people want to nerd out on this stuff, what are the latest kind of tools and treatments that are out there in your need?
So there's a lot of now done in the area of digital dentistry. So for example, like when I place a dental implant, I can place that implant precisely because if I have a CT scan of the patient's mouth, I can make a surgical guide that allows me to actually plan the implant placement ahead of time. So it can be very precise. There's that. There's also techniques that are constantly they may not be technologies, but they're techniques that are being revised that allow us to get better outcomes of our recession cases, for example, or even regenerative dentistry is enjoying a renaissance of sorts because people are now really wanting to save their teeth more so than being so cavalier about taking them out. Because, in the 90s, when dental implants started becoming very commonplace, people would start taking out teeth that otherwise probably could have been saved because there's this belief that implants were naturally superior. But over the last 10 to 15 years, we've come to see that implants are also not without their potential for problems either. And there's nothing better than what Mother Nature gave us, right? It's really designed in the optimal way. And if we can keep it in comfort and function, then why not? So there's like regenerative materials, growth factors. There's the ability to use the patient's own blood products as mechanisms of mediators of wound healing, probiotics specifically for gum disease, bacteria. Have been on the market now for the last 5 to 10 years. So that sort of stuff. There's some really good websites. There's one called greatgums.ca, which is the website of the Canadian Academy of Periodontology, Ontario Society of Periodontology, that gives anyone, potential patients, good resources on what periodontists do, what technologies there are, as well as Perio.org, which is the official website of the American Academy of Periodontology. Great patient education tools and portals on these websites. And one other thing that I should mention as well, from a technological perspective, is the use of lasers in treating periodontal disease. Now, there's been a controversy in the sense that the companies that sell these lasers want to make you think that it's like the panacea and it's like the golden ticket or magic bullet to treat it. When in fact, it's like any other thing. It's like a good adjunct to what we already do conventionally. But some of my colleagues in the US, especially, that have bought into these fancy laser systems, they swear by it. And I don't think there's any harm. If anything, there would be a benefit to that. So things like that.
Is that they're faster, more accurate, less pain, or like what are some of the benefits? When
the benefits, I think it allows them to cover a bigger area in a faster period of time. There's less bleeding, so that means there's less swelling, less discomfort for patients. And some of the results that they've been getting with even just regenerating bone have been pretty spectacular.
Very cool. Can I ask you a couple of quick fire questions?
You bet.
Best toothbrush, electric or manual?
Doesn't matter.
Doesn't matter?
Yeah, they have both been shown to be as equally efficacious as long as they're used properly. So the advice that I give to patients, if you're going to use a manual brush, get an ultra soft, like whatever brush you use, the bristle should be ultra soft.
Okay.
The advantage that the electric brushes of the rotary brushes have is that they tend to keep people a little more systematic, and they force you to go at certain pressures, certain times in different areas of your mouth, right? So for patients that are motivated by technology and whatnot, this is a great tool that they can use. And if you're going to use a rotary brush or an electric brush, then get one that's high quality. Okay, not all rotary brushes are the same. Like the $20 ones you get at Shoppers are very different from the Oral-B and Sonicare, Braun, Philips type of brushes. So get ones that are higher end. Most dental offices probably sell one of the higher end ones, and you probably get them at a discount compared to what you pay at the drugstore.
Okay. And typically an electric toothbrush is higher end means just faster velocity at the spinning, or is that?
It's just more efficacious at removing plaque and bacteria, and their mechanism of action, like the way they rotate, the way they vibrate, all that type of stuff, is maybe a little bit more effective.
Okay. Your thoughts on water picks?
Love them.
Love them?
Love them. Yeah, I wouldn't say it necessarily replaces flossing, but there's certain areas where just the floss alone may not be effective. Like some people have gaps between their teeth, or food gets stuck in certain areas more than others, and they find just like a single, thin piece of floss to be not as effective. Water picks are great, leaves your mouth feeling fresh, easy to use. In fact, I recommended one to my dad a few years ago, and it's completely changed things for him.
Very cool. Very cool. How about whitening strips?
Whitening strips, again, more cosmetic. Whitening strips are pretty harmless, and you can get them at the drugstore. Sometimes they can cause some transient sensitivity in patients' mouths. Now, the thing with whitening is that if you don't change the underlying habit that led to the staining in the first place, then you're going to be using whitening strips more often than you want to, right? So if you're drinking 9 cups of coffee a day, then you might want to cut it down because that staining is just going to come back just as fast.
Got it. And then when somebody sees bleeding gums, is it panic? Is it normal? Like when do they get worried, or should they get worried right away?
I wouldn't worried per se. I mean, if you have bleeding gums, just go to your dentist and say, hey, listen, my gums are bleeding. And a lot of times it can, again, be fixed with just a good round of deep cleaning. If your gums are bleeding and like puffy and they just don't stop bleeding, then maybe I'd say, okay, like get a periodontist referral right away, or even just get a blood test. Because it could be one of those things, right? Like rare occurrences where someone has some underlying blood disorder that's causing this. Like I've actually seen a couple of patients, unfortunately, where there's something about their gums and the way that it bled that tipped me off. It's something a little bit more sinister. Sent for a blood test. The patient had leukemia.
Oh, wow.
Right.
Wow.
Yeah.
What are some habits that people might have that are very, very bad for their teeth that they may not even realize they're doing, like grinding teeth? Are there other things that people do that they should just watch out for?
Yeah, so grinding teeth is something that's very common. It's what we call a parafunctional habit. It means that we're not aware that we do it, because most people are not grinding their teeth during the day, they're grinding at night. And the only way they know that they're grinding is because their partner hears like the sounds of, like, if you have a couple of dice in your hand and you're like crunching them together. Or over the years you realize, oh my God, why do my teeth look so flat? Because you're grinding them. And so you can't really control that, but we can give you a night guard or a mouth guard that helps prevent the surface of your teeth grinding against each other. There's also hard toothbrushing, right? A lot of people think that you're brushing hard means your teeth are cleaner. Yeah, your teeth are clean, but you're going to be brushing your gums away and you're going to be causing abrasions to your enamel and the root surface. So, gently, you don't need to brush hard to brush effectively. And funny story here is about 5 years ago, I got sent a prototype toothbrush from this company in Israel that had this feature where if you exerted more than 150 newtons of force, the head of the brush would bend back.
Oh, really?
So I was like, oh, wow, 150 newtons, that sounds pretty large. I kid you not, Laurent, first time I used this brush, I put this toothbrush, as soon as I touched my teeth, the head bent back. And so I had to figure out what was that perfect force that would not cause his head to bend back. And I realized it's actually really not that great of a force that we need to brush our teeth effectively. So it's hard brushing. Some people have these habits we call factitious habits, where they're like picking at their gums with their nails. And that can cause problems too. Other things, I don't see this as commonly in the Gen X population, but women with tongue rings or tongue piercings, it just destroys the front teeth and the gums.
Really?
Or any type of oral piercing can do it.
Okay, very good. How about sensitivity? There's a lot of toothpaste on the market where, to me, it seems like it masks the issue. Like, if you have any sort of sensitivity, should you be getting that fixed, or is that something you can live with? Like, how important is that?
A lot of people can live with the sensitivity if they know how to control it. And there's some fluoride rinses on the market, or toothpaste like Sensodyne, for example, that help to desensitize the areas. People have sensitivity because of primarily they've got exposure of their root surfaces because of gum recession, right? Or some people just have thinner enamel and genetically just have more predisposition to sensitivity. There's no real definitive means to treat sensitivity in a conservative manner. Like sometimes people will get root canals done just because their teeth are so sensitive, but that's also a bit on the aggressive side of the spectrum. So I think it's one of those things where you're better off just treating the symptom. If you have gum recession, a lot of times we can reduce or eliminate the sensitivity with a gum graft by covering up that root surface and covering up those free nerve endings that are sensing that stimulus of cold or hot or what have you.
Got it. Okay. Anything we didn't cover that we probably should cover? I mean, I know you do get into some pretty large surgeries when there's many teeth that need to be replaced. Like, can you maybe talk briefly on that, like what somebody can expect if they have to go through a large procedure? Yeah.
So if you ever have to have traditional gum surgery done, it can be a bit overwhelming. So I see a lot of these patients, we do these surgeries under sedation, conscious sedation, where we start an IV and give them a drug just to help with the anxiety, keep the blood pressure under control. The surgery itself can be pretty straightforward from my standpoint. And I'm not going to get into the technical details of what I do in the surgery, because that doesn't matter. Because all that matters to the patient afterwards is how am I going to feel, right? Mm-hmm. So, you're going to have some sensitivity of your teeth, because what we're doing with a surgery is essentially a deep cleaning, but now with the gums flapped open so we can see everything. Okay. So by scraping the roots and the gum, by scraping the roots and reshaping the bone around the teeth, it is going to lead to some sensitivity post-operative. Be some swelling, some bruising for a few days. Teeth may feel transiently mobile. You might also feel like more food gets stuck between the teeth initially. And so the thing with gum disease that's very unique compared to a lot of other specialties in dentistry is, as I mentioned earlier, there's no signs or symptoms really. Patients don't feel pain. Like, when your tooth hurts because there's a cavity, you might need a root canal, you're inclined to do something about it right away. Or when you're 17, 18, your wisdom teeth are coming in, it hurts when you're erupting. And so you're going to go see your friendly neighborhood oral surgeon to get these teeth removed. Periodontal disease is the silent killer. Like, you don't really realize you have it until your dentist tells you. And sometimes it's like, oh my gosh, like, why didn't my dentist tell me earlier? Right? Because they've been trying to manage this. So if surgery is required, patients now say to me, hey, I never knew I had a problem before, but now after the surgery, now I have a lisp, I have sensitivity, I have mobility, and it's a bit of a catch-22, because you want to treat the disease, but you've created problems potentially in the short term that the patients never had to begin with, right? So that's really sort of the conflict that I have as a periodontist, right? But there are lesser and lesser invasive ways that are being developed over the last 10, 15 years to mitigate some of these aesthetic changes that can occur as a result of treating gum disease and sensitivity.
Fantastic. This has been great. If there was one message that you would want to leave with Gen X 40 to 50-year-old men about oral health, what would it be?
I would say, gentlemen, oral health and total health go hand in hand. The mouth is a gateway to the rest of your body. Just like you spend time going to the gym, working out to keep your body healthy, you've got to do the same things with your oral health. Brush twice a day, floss once daily, and at the very least, go to your dentist every 6 months for checkups and hygiene. And make sure that they do a gum disease screening so that if any further interventions require, they can make the appropriate referral or send you to the person that may be coming into their office once a month or whatnot.
Perfect. Vinay, this is great. Where can listeners learn more or connect with you and your clinics if they need that next step of expertise?
So my website is Aurora Perio, EURORPERIO.com. That's the place I work in most frequently. I have two locations that I'm working in currently. One's in Aurora, where I'm 3 to 4 days a week, and one's in the West End in Mississauga. And the website for Mississauga office is dentalspecialist.ca. Very, very easy. I'm also very active on social media. So if you want to see what I do on a daily basis, my Instagram handle is at Dr. Bide Perio. And I guess you can provide them with that as well. So
we'll put all that in the show notes.
You can message me on that platform, interact however. If you have any questions, I welcome it.
Perfect. And we'll get you on the Gen X Collective platform as well, so people can interact there.
Fantastic.
Awesome. Well, Vinay, thanks so much for taking the time and walking us through all this, and looking forward to hearing what kind of questions come out of this. I think oral health is incredibly important, and I learned a lot today, so I appreciate that.
And again, thank you for having me, and thank you as well for your vision in starting this group, which I think is very, very important. There's not really anything like it for our cohort. And also recognizing the importance of oral health as an important component of overall health. I really appreciate
that. Awesome. Thanks so much, Vinay.
Thank you, Laurent.
Talk soon.